A healthy body is a guest chamber for the soul. A sick body is a prison. It's time for your consultative medical show, Doctors on Call. Warm regards to you, I'm George Oraro. On call, we have a psychiatrist, Dr. Catherine Mutisya, and Dr. Musimbi Ondeko, a chiropractor. Do get your phones ready and start sending in your questions to our SMS 22316. Remember, you have the option of calling in live on the number 020-4200-600. Now today it's an all-ladies show. I'm sandwiched in between two women, but I'm not complaining. Perhaps we could start with you, Dr. Ondeko.
Yes.
Brief introduction on yourself.
My name is Dr. Musimbi Ondeko. I'm a doctor of chiropractic. I've been practicing for the last over 30 years.
That's a long time.
It's a long time. And I've enjoyed every year of it, enjoying the results of the work that we do as chiropractors. And I'm here to help answer any questions that I can.
Being
Look forward to that.
Being that there's only 7 of you in Kenya, around 7, do you find it overwhelming?
It is somewhat overwhelming to the point where now we're thinking, okay, what next? But we are hoping that at some time in the near future, we'll be having people trained locally. Because most of the people that you're talking about have been trained abroad.
Yeah, there you have it. Welcome to the show.
Thank you.
Welcome to our new set.
Thank you,
Dr.
Judge.
Catherine Mutisya,
Yes.
we are glad to have you on the show.
Thank you.
Perhaps a brief introduction on yourself.
Yeah, my name is Dr. Catherine Syengo Mutisya. I'm a psychiatrist. I've been practicing for the last 14 years, both in public and in private.
But as a now private practice?
Both. Public and...
You're balancing.
Yes.
Karibu sana to the show.
Yes.
To start us off, there seems to be confusion between a psychiatrist and a psychologist. What's the difference, perhaps, so that the public could know?
Okay. When we talk of psychiatry, it's a branch of medicine, a specialty of medicine, where you have to become a general practitioner, then specialize in psychiatry. You deal with the prevention and treatment of mental disorders. Whereas psychology, you don't need to be a medical doctor in the first place, and they mainly would do psychotherapy, which is talk therapy, because they are not able to prescribe, although in other countries you can advance and be able to prescribe. We work together because you need diagnosis, medication, and you need also psychotherapy. The psychiatrists are able to link up with the other physical illnesses, because you find that the mind and the body, they are related, such that if you have a physical pain, for example, it will affect your mood, and so they are able to bring in both aspects. Yes.
Karibu sana, Dr. Mutisya.
Asante.
We are more than glad to have you in the studio today. To start off, I have a rather interesting question here for you, Dr. Ondeko.
Yes.
I'm 49 years old woman with waist 30, hips 53, and a small upper body. I get backaches occasionally. My hip size related to the back pain?
That's a very interesting question. She's already 49 years old, so I'm assuming that these hips have not necessarily just suddenly become very big, and she's probably had a large hip size for probably her life, most likely. There are various different body shapes. There are those people who have no hips at all. There are those people who have rather large hips, like perhaps herself. But this is not necessarily a cause for backache. There are other different causes that would probably give her backache, but she's looking at that as something that might be the one that is causing it, and therefore probably not addressing the actual problem that she has. Okay. So I would suggest that she have it examined rather than just assume that it is her hip size that is causing her the problem.
Okay, that's an interesting one.
Yeah.
Thank you, Dr. Ondeko, for that response. What does it mean to have mental illnesses?
Yeah, for example, first of all, I would like to define what good mental health is. When somebody has good mental health, it means that they are able to deal with any adversities which occur in their lives. They are able to relate well with other people, and they are also able to live up to their potential. They are able to contribute towards the society. Then mental disorders, then are disorders of basically thoughts, behavior, which actually affect your productivity and affect your relationships, and there are of various numbers. Like there are people who have anxiety, which is basically like excessive fears, We also have depression, where people don't feel like they are not happy, they are sad most of the time. We also have other disorders like...
depression can lead into mental illness.
Depression is one of the mental illnesses.
Itself?
Yes.
How so? Being depressed, because I'm trying to figure it out.
You see, basically, people, when we talk of depression, people just think of mild changes of the mood, because you and me, every other person will get sad here depending on the circumstances. But when you talk of depression, clinical depression, this is somebody who has been sad most of the day, is not able to move on with their life, and sometimes it can be so severe such that this person is not feeding, is not talking, and so even they get dehydrated because they are not eating, and when it is that severe, we have to admit. But there are mild cases of depression also, which can be treated as an outpatient.
Okay, so thank you for that clarification. Doctor?
I think it must be because some people just say, I'm so depressed.
Yes.
Also
Now,
ladies.
that one does not need a psychiatrist.
Ladies. Yes. Ladies, it's so common with ladies.
This is
Yeah.
the thing. So
Yeah.
let's not confuse that, and so that people don't start thinking, okay, now I need to be admitted or something
Yes.
like that.
Yes.
That's
I have
not right.
depression.
Yeah, I have depression because I'm saying, something has just happened, and they think that, oh my goodness, you know. Yeah, but that one is not a clinical one like the one that Dr. Tari is talking
As
about.
described.
Yes.
Yeah, so I hope the confusion will not go
Yeah,
there.
exactly.
We have another question here from Esther. She has suffered chronic back pain almost 10 years now. She's been on physiotherapy and hydrotherapy with little relief. What should she do to alleviate the pain once and for all?
It's been 10 years. She's probably been referred by an orthopedic surgeon or a physician to go for physiotherapy and hydrotherapy, which are sometimes a form of exercise or sometimes a form of heat therapy, etc., etc. There's probably some underlying misalignment, which we in chiropractic call a subluxation, or a bone that moves out of place and doesn't go right back into its normal alignment. And sometimes until that alignment is properly corrected, then the exercises aren't as effective as they would be otherwise. So if she would have the time and opportunity, she should have her spine checked, whether she has the right alignment or not, and then perhaps the physiotherapy or the hydrotherapy could complement that, and she can be able to get the relief she's looking for.
There you have it, Esther, right from Dr. Musimbi. Dr. Mutisya, what will you consider, or at what point will you consider a mental illness to be severe? Because from what you told me earlier on, it's in stages. So
Yes.
at what point is it severe?
Yeah, it is severe if it affects your productivity, it affects your relationships. And so if somebody is depressed to the extent that they are not able to socialize, like if it's a mother, they are not even taking care of the needs of their child, they are not responsive to the needs of their child, it's affecting their social relations. Then somebody who is depressed to the extent that they are not able to wake up and go to work, then that is severe. So mental illnesses will range from mild to severe. Severe ones will need admission. Mild ones can be treated as outpatient. There are some which might not even need medication, will need talk therapy, and they are able to adjust.
Okay, thank you for that. Remember, on call today we have a psychiatrist and a chiropractor. This is Doctors on Call. We are live on Family TV and Family Radio 316 as well. But coming up is a song by Plumb. It's called Drifting. We'll be right back.
There's a sea of lonely, swimming sad, looking just for an arm to grab. I don't need to understand, I'm just lending you the two that I have. Oh, you might be drifting, can't find the shore, so hopeless and all alone. The way
That's Drifting by Plumb feat Dan Hazeltine. You should not also drift from this topic because we believe today's show is very much interactive and it's going to be of great importance to you. On call once again, I do have a psychiatrist, Dr. Catherine Mutisya, and a chiropractor, Dr. Musimbi Ondeko. Our SMS line is 22316. Remember, you can still call us on 0204200600. Moving on with the show. Other than Mathare Mental Hospital, which other facilities offer treatment?
Okay, basically, the hospitals we used to call provincial hospitals had a psychiatrist and a psychiatric ward. So basically, all general hospitals at that level, which are now county referral hospitals, have a psychiatrist, most of them. There are some without. And we have some level 5 hospitals, which were slightly bigger than district hospitals, which have psychiatrists. So basically there is the public system, and also there are various private hospitals which offer psychiatric treatment also.
Okay, thank you, Dr.
Yes.
Mutisya. Dr. Ondeko, my mother got a slip disc 2 years ago and she has not yet recovered ever since. She's always in pain down to her feet. Is it possible for the disc to go back?
It's very interesting. Slip disc is a very interesting. It makes you think that something has completely moved out of place. When we talk of a slip disc, it's usually a disc that is bulging. And that bulging is the normal function of a disc, because the disc works like a shock absorber. And so if things around that disc are not working in the right manner, then the disc bulges, or if there is pressure on it, then the disc bulges. So a lot of times we focus on the disc rather than focusing on what is causing the disc to bulge. So perhaps what she needs to have looked at is what is causing the disc to bulge. So then if that is dealt with, then the disc can go back into its normal alignment. And that's what we would normally do.
What are some of the instances that would cause the disc to bulge?
If, for example, I'm about to bend over and I'm about to lift a heavy cylinder of gas, and perhaps I'm not bending over in the right manner. Many people have a tendency to use their back to lift. Back muscles are not designed for lifting. They're designed for holding you upright. But when you bend over in the wrong manner and you try to lift, then the back muscles are trying to do something they're not designed to do. As a result, the disc has already moved backwards in order to allow you to move forward. But then the body recognizes, because we have to understand that this body is very intelligent, it recognizes that the back muscles are in danger. So what happens? The abdominal muscles contract. And that's why you find some people say, I just bent over to lift something and I got stuck. That getting stuck is because the muscles in the abdomen are actually protecting the back muscles, but then the disc has already bulged backwards to allow you to bend forward. So something like that can cause a disc to bulge. So now we need to figure out, is it the disc that's a problem, or is it the contraction of the muscles in the abdomen that's a problem? And then make the correction necessary, and the disc should go back to where it belongs.
Okay, thank you for that, Dr. Musimbi. Dr. Mutisya, we have another question here asking, is schizoaffective curable?
Schizoaffective
illness. Sorry about that.
Now, schizoaffective illness is a biochemical change in the brain with the symptoms, what we call psychotic symptoms, where the person might have hallucinations, that is, they see things other people can't see, or they hear things other people can't hear, with disorganized behavior, and at the same time, schizoaffective. Affect is the mood. So the psychosis bit is the schizo, and the affect is the mood, where in addition to the psychosis, the hallucinations or delusions, their mood is also affected, meaning they could be sad or they could be having a high mood, what we call manic episode. So schizoaffective illness is a biochemical change in the brain, and so that person might need to be on medication throughout their life to balance the chemicals, what we call dopamine. So people can live a normal life if they are taking the right medication and if it's the correct diagnosis. Yes.
So in short, it's not curable. It's treatment life.
It is manageable.
Manageable.
Yes.
I think manageable is the right word to
yeah,
use.
when we say it's not curable, you discourage the person suffering, living with it. Yes.
Manageable is more warmer.
Yes.
I'd say. Thank you. I have this recurring numbness on my right arm, which comes on and off. Could it be dealt with a chiropractor? He's 64 years old and he's male. It's anonymous.
It's anonymous. Okay, he's having numbness. Numbness basically means that you've got irritation on a nerve, because you can either have numbness or you can have sharp pain. They are both irritation on a nerve in one way or another. And usually the arm has the nerves that exit from the neck that go down into the arm. So there's a high possibility that he might have something going on in his neck that is causing the numbness down the arm. So this is where we would now examine the neck to see, is everything okay there? Do we have some changes that are taking place in there that are causing irritation on that nerve, etc., etc.? And if we are able to correct that, then the numbness is usually attended to.
Thank you.
It can go away.
Thank you, Dr.
Yes.
Ondeko.
Yes.
Dr. Mutisya, there are so many myths about mental illnesses that are out there. One of them being they never get better, or they are violent, and their place is mental institutions. Now, is it true?
Yes, it's true that mental illnesses are associated with a lot of stigma because people do not understand them. Because when it comes to mental illnesses, you don't do a test and say, this test confirms that you have schizophrenia, or it confirms that you have depression. And so it is a diagnosis of exclusion, where if I come with abnormal behavior, I will do tests to make sure that I don't have malaria, I don't have a tumor in the brain, I don't have stroke in the brain. And so it's a diagnosis of exclusion. Again, many people in our setup will conceive it to be witchcraft or spiritual warfare, and by the time the person reaches the doctor, probably they have tried some of those treatments they think they are appropriate. And for us to be able to break the stigma, we will need to give the right information that mental illness is a combination of sometimes genetic predisposition, again the environment, because stressors can trigger one to have a mental illness. Substance abuse, like we are seeing people who in their family lineup, they didn't have schizophrenia or psychosis, but because of starting to use cannabis or marijuana when they are less than 18, when their brain is still developing, you find that now they are developing the psychosis. So it's a combination of genetic predisposition. It doesn't mean that if in your family somebody had a mental illness, it's 100% that other members will get the illness. It's a combination of even how these people are able to manage their life, control their stressors, be able to deal with day-to-day life challenges. Mental illnesses are treatable in terms of once we make the right diagnosis, give the right treatment, these people can be able to work even if they are taking their medication. Just the same way somebody suffering from diabetes or high blood pressure is able to continue working even though they might have to take their medication for life. There are some mental illnesses where you may not take your medication for life. It's given for some time, then tapered and stopped. But there are other mental illnesses where you might have to take medication for life.
Okay.
Yes.
Thank you for that highlight. I have pain from the left side back of my head up to the waist, and feel like crawling sensation on the left side as well. What could be the problem?
There's definitely a lot of nerve irritation there. There are many people who have bad posture, okay? And because of bad posture, the body then tries its best to cope under the given situation. Right now we are finding that many people have a tendency to work like this at their desk, to look down in this manner, or to be always texting on their phone. So there's this constant flexion, what we call flexion, constant bending of the neck. Now when you bend the neck, you're actually using the two vertebrae right up in the top, which is like at the base of your brain. There's something called a brainstem in that area. And sometimes if you just turn, like the other day we were talking to a certain young man and he says he has a tendency to turn this way. When you turn that way, you're then causing an irritation right in this area. And that one will affect that whole left side going all the way down. So that's probably what they need to watch out for, how they are using their neck, and therefore